Now, it may not be talked about as often as it once was, but HIV and AIDS are still very much a real danger.
Well, here in Israel, the Ministry of Health is now looking to combat the disease's spread, and joining us with the details is attorney Chen Shamilo, the General Director of the Israel AIDS Task Force. So our first question for you is, what is PrEP? It is a new treatment that is now going to be available to the Israeli public, correct?
Right, so it's not that new because we have PrEP in the world since 2012, and PrEP, thanks to the Israel AIDS Task Force and the Medical Association activities in Israel since 2017. PrEP is basically a pill taken either daily or on demand by HIV-negative people to lower the risk of getting HIV.
So why is it only now kind of being discussed and being brought up as part of the health package?
PrEP is accessible in Israel only through the add-on insurances, the complementary insurances. And so only people who have these insurances can afford, and it's still in a high cost of about $100 a month.
Wow.
And so we requested the scientific committee of the Israeli Basic Health Basket to include this treatment into the basic health basket. And this is the third year, actually, that the committee has been discussing this issue. This time, as we heard yesterday, we were lucky to hear some of the objections to this request.
Now, why was there such a controversy over this drug?
Well, PrEP is a very unique issue where you have to understand the culture and the sexual health behavior of specific groups at risk in order to fully understand its importance and its impact on the specific communities that we're dealing with. And so I guess the some of the committee members weren't knowledgeable enough about how you implement PrEP and get to a better results or better lower rates in Israel in terms of HIV.
Do you know what the rates are right now?
So Israel is considered a relatively low-rate country, but in the past 2 years, we've witnessed an increase in newly diagnosed cases. Some of them in specific groups at risk, of course, but also in just the general population.
Why is that the case?
And so there are like various trends in public health. We're looking into them right now, and the figures are not, complete yet.
Are people ignorant of the dangers?
Some people are indifferent about the risk. Young generation is a little bit fearless sometimes about risks of getting HIV or sexual behavior in general.
Which is maybe because we also don't hear about it in the news as often.
And
right?
also it is mistakenly, I think, perceived as kind of a non-issue. It's not a big public health concern anymore, even though it should be, because it's still HIV/AIDS is still a life-threatening situation.
Well, I'm sure a lot of people are probably thinking right now, why is a condom not enough?
Well, first, condom is very important, and we still advocate and educate people about using condoms. PrEP is an additional tool, a very effective one, evidence-based strategy to get to lower rates and even to get to the ultimate goal, which is getting to zero new infections within 2 years. That's a goal that we at the Israeli AIDS Task Force are now pioneering. We're pioneering the call upon the government to set the goals there. And so if we want to get there, PrEP must be included in the basic health basket because it's proven as a very effective tool in addition to condoms. Now, some people that are at high risk, and I would say even the highest risk people, are either reluctant or incapable of using condoms in a routine manner, and so they definitely need this component of PrEP to be more accessible for them.
So, one of the issues, the government is currently facing a major budget issue, especially when it comes to the Ministry of Health. Are you sure that this drug is going to be able to get into the medical service basket?
I must say that I can't be very much optimistic about it because of the financial barrier that you just mentioned. But I would say that since it's the third year in a row that we've been requesting the committee to include PrEP, if this year it won't work, we will demand directly from the Ministry of Health to fund PrEP through other channels that they have. So we are not quitting. We definitely have to push forward. So PrEP will be available, for example, soldiers. They don't have PrEP in the military basket now. People are uninsured. People who are just can't afford paying, about $100 US a month to be safe and not getting HIV.
All right. Well, thank you so much for joining us.
Absolutely, Chen, thank you.
Important issue.